Is it just me, or does it seem like everyone is sick right now? Lots of the illnesses going around can impact your ears and nose, and joining us today, Dr. Lisa Mulligan, an ear, nose, and throat surgeon from ProLiant Surgeons Puget Sound ENT, to tell us what families with kids should know. Thank you so much for being here.
Yeah, good morning, Kelly. Thank you for having me.
Yes, so we are right in the thick of cold flu season, and parents are feeling like their kids are constantly sick. What are you seeing right now?
Yeah, it's true. So this time of year, parents have concerns about their little ones. Nasal congestion, stuffy noses, and particularly in infants and babies, they can't take medication, so there might not be a whole lot they can do. But it can be helpful to use like saline drops, gentle bulb suction to clear the breathing passages, so these children can sleep more easily, feed more easily. This time of year, we're also seeing more ear infections in kids, yeah.
Okay, so a cold can lead to an ear infection, right? And why is that?
Well, so colds can actually affect this pathway between the ear and the back of the nose and the throat that we call the eustachian tube. So the stuffy nose can result in eustachian tube dysfunction and blockage. And under those circumstances, fluid, bacteria, viruses may build up behind the eardrum, or what we call the middle ear space. And then the child would experience, an earache, fever, difficulty sleeping, might prompt a visit to an urgent care center or the pediatrician to get a course of antibiotics.
Definitely. And what happens when those infections keep coming back? Because I hear this a lot from my friends that are parents, like, another infection, here we go again.
Yeah, well, people do have concerns about, administering antibiotics to their children, frequently, although for the most part, that is a safe practice and effective. But when ear infections are made more than 3 in a 6-month period of time, it may be worth talking about the placement of ear tubes. So ear tubes are placed directly into the eardrum under a general anesthetic with gas. As you can see here, I wanted to show you, ear tubes are actually pretty
so little.
Yeah, they're pretty tiny, and they last for about a year, and then they generally fall out on their own. And kids usually do outgrow these problems, so we don't really need any long-term solutions. But ear tubes can reduce the frequency and number of ear infections in these little ones.
Amazing. So then, since they kind of can outgrow that, what do you do when they're older?
Well, in terms of older having problems with nasal congestion, even in those circumstances, if they're having ear infections as a result, that may be part of the remedy. But once a kid's about 2 or 3 years old, they still could be getting congested from colds, of course. But then we start to think there might be a structural problem. So if there's snoring, mouth breathing, difficulty breathing because of physical activity on an ongoing basis, we might want to examine them for blockages.
That makes sense. And what does the evaluation look like overall?
So when families bring their kids in, we want to take a good look in their nasal breathing passages, and we're going to be looking in the nose for something like swelling. Swelling might be managed with medications like nasal sprays or, again, saline. We might want to investigate the cause of that swelling, possibly for allergies. Environmental controls put into place, can be worthwhile. We might discover that they've developed enlargement of the tonsils or the adenoids, in which case, under certain circumstances, surgery may play a role.
Makes sense. And when should parents bring in their child to see a specialist?
Well, when ear infections and nasal congestion, are persistent, it can affect the child's ability to sleep well, speech development, dental development, physical activity. And, I've raised a family. I have kids, and things can affect the well-being of the child, the well-being of the family. And so, I like to partner with the families, help them understand what's going on, and hopefully, offer some solutions or some remedies that, fit their individual family situation.
It makes perfect sense. Where can people find you? How do they get more info?
So Puget Sound ENT has 3 office locations. We're located in Edmonds, Creek, and downtown Seattle. And we can actually offer hearing tests on site. We have pretty good availability for appointments. Usually we can get people in within a week, and sometimes even in a day or two.
Amazing.
And we have our own surgery centers, so we can do surgery on site in the circumstance where kids might need surgery, and that makes it easier for them to access that care.
Thank you so much for being here. Fantastic info. And to learn more information, just visit the website that you see right there on your screen. That's PugetSoundENT.com.
New Day Northwest is sponsored by Proliant Surgeons Puget Sound ENT.